Hi, I'm Dr. Aryana, and welcome to Tech Talks, a series where we take a closer look at the technologies transforming medicine today. Today, I'll be walking you through AFib, what it is, how it works, and how it matters to both clinicians and patients. So let's get started. Atrial fibrillation is a rhythm disturbance of the heart that typically arises from the top left chamber of the heart. It results in chaotic and rapid activation of the top chamber of the heart, which in turn gives rise to increased pooling of the blood in the top chambers of the heart, resulting in a potential risk for clots to form, which can then dislodge into the brain, causing a stroke. In addition to that, the rapid and chaotic activation of the top chambers of the heart can also lead to increased risk of heart failure in some patients. For all these reasons, it is absolutely imperative to identify and diagnose this condition early and to implement appropriate therapies at an early stage. In the procedure of catheter ablation, catheters are advanced through the veins at the top of the groin all the way to the heart. And the vein that joins the top right chamber of the heart, called the right atrium, is the site of entry of the catheters into the heart. The catheters are then advanced from the top right chamber of the heart to the top left chamber of the heart, where most of the ablations are performed for treatment of atrial fibrillation. Some patients with atrial fibrillation also have other arrhythmias that require treatment in the top right chamber of the heart, but this is all identified and diagnosed and treated accordingly at the time of the ablation procedure. During catheter ablation, catheters are advanced into the heart and connected on the other end to a computer mapping system, which allows us to create what we call a three-dimensional electroanatomical map. A 3D map of the heart, which not only shows us the anatomical details of the heart, but also the electrical details of the heart. This in turn then allows us as operators to be able to identify the abnormal spots and locations and triggers for the cardiac arrhythmia in question and target them using various energy modalities. That is, to ablate them and to get rid of them. Patients who are unable to tolerate blood thinners to prevent this risk of stroke become oftentimes a suitable candidate for a left atrial appendage closure procedure. Mercy General Hospital is the highest volume left atrial appendage closure program in Northern California. Proper sizing and deployment of left atrial appendage closure devices is important. It's critical to the success of the procedure. These procedures are performed at Mercy General Hospital guided by transesophageal echocardiography or intracardiac echocardiography. And following the procedure, the same types of imaging or sometimes CT is used to ensure the success of the procedure and to confirm appropriate closure of the left atrial appendage. Thanks to modern technology, many of our patients have access to smartwatches and detection devices that allow them to monitor their heart rhythm. These types of devices have played an important role in helping our patients identify cardiac arrhythmias and allow also for early referral of these patients to clinicians and physicians to implement therapy. Today's tools are powerful, but the future of AFib care lies in expanding access, accelerating diagnosis, and delivering even more personalized treatment and treatment options. So that was a quick look at atrial fibrillation. As the technology evolves, so does the way we care for our patients. And it's critical to stay informed. So thank you for watching Tech Talks. We'll see you next time.